We're going to give a second for others to join. But as you're joining, please leave your name, health council name, or organization, your affiliated organization in the chat. So welcome today. I hope everyone's having a good Friday so far and enjoying yourselves and preparing for the weekend. So let's see. Hi, Joyce. Hi, Mary. Thanks for joining today. And I see Lori. Hi, Lori. Okay, so I'll just get started with a little brief introduction. Welcome again. If you're not familiar with Health Council Talks, the Alliance hosts these sessions every first and third Friday of every month. Essentially, the purpose is to bring presenters and topics and resources for health councils all in one setting. And we will be recording this session and sharing out resources after our session today, but also any PowerPoints as well. And so just be on the lookout for that information through our weekly announcements sent out by Sam. And welcome everyone. Do you see we got a few more joining? Hi, Jenny. Hi, Deborah, Holly, Enrique. It's nice to see you all today. And we've got a great discussion today around microaggressions. And so that's going to be done by Jesse. And so we'll just go ahead and open with our acknowledgement, Sam.
Thank you, Geraldine. New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nation, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and the ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nation sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations who are still here today.
Thank you, Sam. And so we'll go ahead and jump into our presentation today from Jesse. Thank you so much for joining us today and being with health councils and all of our statewide partners. And just to give you a little overview of what today's discussion will look like, and I know Jesse will probably go into this a little bit more, but really our topic is around microaggressions. And I know that this can definitely apply to some of the health council work that we're doing, creating those safe spaces and having some of those conversations in our health councils or maybe with partners, but also looking at how to rebalance discomfort, especially around communications and maybe things that may cause harm to the group or individuals. And so, yes, I will go ahead and pass to you now, Jesse.
Thank you all so much, and thank you for that beautiful land acknowledgement and introduction. I'm going to go ahead and start sharing my screen. Can everybody see my PowerPoint? I know it's not in presentation view because I can't drive as well, but hopefully you all can see it and can hear me okay. So I was asked to come in and share on microaggressions and do a training. And as I was getting ready to prepare this content, I was really thinking about how discussing microaggressions is an opportunity for us to really heal harmful systems and act as agents of change in any groups that we're a part of. So I want to introduce myself. I'm Jesse Hernandez. My pronouns are she, her. My professional identities, I have a master's degree in social work, specifically in positive youth development and in child welfare. But I've mostly been doing macro level work in hospital systems and designing county health needs assessments in my time since I stepped back from doing child protection. I currently work at Alianza of New Mexico here in Roswell. We have offices in Roswell and in Las Cruces. I didn't have this role when I was originally engaged to do this presentation. But I am now the program and staff development manager for Alianza, where we're doing HIV case management services and harm reduction services. And like I said, I primarily work in meso and macro level systems of care, and we're going to talk about that. In terms of my personal identity, I am white, I am a cis female, I am married to a cis male man, I'm a landowner, and I'm the caretaker of a piece of land that is on the ancestral homelands of the Mescalero Apache peoples. And when I do work like this, all of the money that I make doing these types of, I'm actually taking this opportunity to help you all with the Health Council training content pro bono. But when I do this type of work, if I'm getting paid, that money goes to Mescalero Apache people as a part of a land tax that I have chosen to pay as a part of the work that I'm doing in anti-racism spaces. And I just wanted to name that that's an opportunity that we all have in positions of privilege to actually go outside of normal structures to honor the lands that we're on in very material ways with money when we can. So we know in Health Council spaces that discrimination leads to poor health outcomes, generational trauma, inequitable access to services, right? You're all part of Health Councils where this data is really something that you're in all the time. I did community health needs assessments for Santa Fe and 6 surrounding counties. It is uncomfortable for folks to be discriminated against. They are uncomfortable coming into a space that's not being safe. When you are a person who has been historically marginalized and you're coming into a dominant white space, for example, it's uncomfortable. When you come into a space and there's nothing in your language, it's uncomfortable. So when I'm talking about rebalancing discomfort today, I want us to start with an understanding that discrimination is uncomfortable. I think that might be something that we're all kind of aware of, but I've never actually heard anybody name it, and I wanted to name it. So when folks with privileged and protected identities are willing to do the anti-racism work and are willing to be uncomfortable, that's part of what we can do to create safer spaces and work towards contributing to collective healing of those systems of discrimination. So I want to share a quick video that's going to help us get oriented to the content of microaggressions and identity.
Is the unearned advantage we get from being part of a dominant group whose needs have traditionally been prioritized. We can experience privilege because of our gender, race, sexual orientation, ability, class, or other identities. Many of us experience a combination of privilege and disadvantages. For example, white women have privilege because of their race, but are at a disadvantage because of their gender. The privileges we have or don't have can have a big impact on our experiences at work. For example, people without disabilities can usually assume that the software their company uses will work for them. But people with disabilities often have to ask whether a tool is accessible. And if it isn't, they have to ask for an alternative. Or consider religious holidays. Employees who observe a dominant religion's holidays, like Christmas, can generally expect paid time off on those days. But employees who belong to more traditionally marginalized religious communities, such as Muslims, may have to use their vacation days to participate in holiday traditions. It's important to remember that privilege isn't something we earn or choose. Privilege is structural. It exists because our society as a whole prioritizes some groups over others. But while we can't control whether we have privilege, we can become more aware of it. That awareness is crucial. If we don't understand that privilege makes it easier for some people to succeed, we might think the more successful group is just working harder.
Here's an example. In corporate America, for every 100 men who are hired into manager level positions, only 72 women are hired. This isn't because men are more qualified. Instead, it's largely because men benefit from unearned advantages in the hiring process. One study showed that replacing a woman's name with a man's name on the exact same resume increased the odds of being hired by more than 60%. Similar biases affect people of color, LGBTQ people, and people with other traditionally marginalized identities. In another study, replacing a stereotypically Black sounding name with a stereotypically white sounding name on a candidate's resume resulted in 50% more callbacks, the equivalent of adding 8 years of work experience. And in the third study, when a candidate had something on their resume that suggested they were LGBTQ, such as belonging to an advocacy group, they received fewer callbacks. Remember, in all these studies, the candidates had the exact same qualifications. Privilege, not effort or ability, gave one group an advantage over another.
These examples show why it's so important to understand how privilege shapes our experiences. When we see why women, people of color, and others with traditionally marginalized identities are underrepresented, we can start to address some of the barriers that hold these groups back. But acknowledging our privilege can be really, really tough. It's uncomfortable to admit that we have an advantage we didn't necessarily earn, especially when we've still had to work hard. But when we do start to see the reality of our own privilege, we can also better understand the experiences of people with less privilege. And we can start to find ways to use our privilege to support and advocate for others. In other words, we can become allies.
About microaggressions, and we're talking about privilege and oppression, it's really important to understand, I think, that
Oh, hey, Jesse.
Yeah.
Sorry, your audio's a little bit low on your end.
oh no. Let's see, if I stand closer to my mic, is it better?
Not on my end, but I'm not sure what everyone else is hearing as well.
That's pretty low for me as well.
Let's
Okay.
see, if I switch my microphone, does it get better? Did that get better? It didn't, because you're
No.
leaning.
No.
Okay, let's see. Testing, 1, 2, 3.
Yeah, it's still a little low.
Oh, see, I've done it again. On command.
Okay, let me switch to phone audio. Give me just a second to dial in, okay?
Perfect. Thank you so much.
Absolutely. Sorry about that. We've only been in the Zoom world for how many years now? You would think.
It happens. We experience it all the time, and I'm sure health councils have as well.
Well, and was it working at the beginning?
Yes, it was.
So just after the video?
It's gotten a little louder now. Do you think so, Sam?
Yeah, it sounds a lot better now.
Well, let's see if going by phone is going to help.
Meeting is being recorded. Okay, let's see. Did it connect through the phone?
Yes.
Testing. Okay. Thank you so much for bringing that to my attention. I also meant to say when I started the introduction that I'm glad to take questions at any time during the presentation, but I've created an opportunity for us to have discussion at the end. So I meant to ask the team with the Health Council how they generally do this for these presentations. So if you feel like you have something that you really want to make sure to say, go ahead and unmute yourself. I'm okay with going with the flow of being interrupted if there's something that somebody wants to share or ask, but we will have time for discussion at the end of the conversation. So when we're talking about microaggressions, I think a lot of people really minimize the harm of microaggressions because the word micro means small and people feel like it means like it's a small slight. It's maybe just something that's said that's unintentional. It really doesn't do that much harm. And I've heard a lot of language around microaggressions as being like death by 1,000 paper cuts, and maybe the person who's experiencing microaggressions is experiencing repeated microaggressions that's creating a sense of discomfort over a lot of time. But really, when we're talking about a microaggression, what it actually means is that it is an aggression that's happening between two people. So in social work, and I think in health systems, when we're talking about micro, we're talking about one-on-one interactions. Meso or small groups, group systems, families. This group, for example, is a little meso group of the health councils getting together. And then we have our large global macro systems, healthcare systems. And so I just want to reframe that while microaggressions are defined as being brief, commonplace, verbal, and environmental slights that could be intentional or unintentional, what they're actually doing is communicating the hostile, derogatory, negative biases of dominant culture against and privileged groups against people with less privilege. And so it really is actually when a systemic macro structural bias is present in an individual interaction. And I want to say that because as a white woman with the privilege that I have, it was really important for me to reframe this to really understand that I might say something unintentionally that causes harm far beyond what I've expected. And I might minimize that. I might have a tendency to want to minimize that because it makes me uncomfortable to realize that I've done something like that. And really what I've done is I've demonstrated my own internalized structural biases. And so what micro means is not that it is small, unimportant, negligible. It actually means that it's just taking place between two people and not the system bias, right? So in the video, it talks a little bit about different types of identity and power and roles of privilege, but I really want to specifically name intersectionality as the first place of being able to really start understanding the complexity of these structures of privilege and oppression. The concept of intersectionality really comes from an understanding a legal structure that prevented a woman, a Black woman, from being able to sue her employer for racial discrimination and gender discrimination at the same time, essentially asking that she privilege one of those identities over another in order to seek justice in a case against an employer. And so it literally is the understanding that we have multiple identities that are all taking place at once. And this is starting to get at some of the complexity of those privileged and marginalized identities, the proximity of power, the proximity to power that certain folks have. And again, like it said in the video, it's not earned. So when we look at this color wheel and we see that based on a gender identity, citizenship, skin color, formal education, ability, sexuality, sexual orientation, these are all things that have a certain amount of proximity to power or are marginalized. And where these things intersect, a person might be experiencing multiple forms of systemic and then micro aggressions, right? So there are systemic barriers, and then there are the places where we're in interpersonal relationships where those biases are playing out. And that's why it's so important that we really start to do this work of unpacking and understanding the nature of these identities before we have a conversation about how to address microaggressions. We really need to understand where they come from and who is at risk of committing them and who is harmed by microaggressions. Is this content that you have all seen before? I don't see a lot of cameras on, but I'm just curious if this is something that the health councils have discussed.
Perfect. Maybe we can use emojis like Anna. We've got one hand up, a yes in the chat.
Great. Awesome. Thank you. I appreciate that. It doesn't seem to matter.
I just want to correct, yes, Jesse, Ms. Hernandez, that I don't think we've talked about it as a group specifically.
Great. Thank you so much, Anna. I think that it's it doesn't matter how long I've done these Zoom conversations. Sometimes I'm looking at the screen and I'm like, uh-oh, is everybody still there? So I appreciate the checking in really quickly. And I think it's important to do some level setting for this group specifically if we want to talk about how to address any microaggressions that might actually take place in the group. So when we talk about these different aspects of identity and identification, and this comes back to how I did my introduction, I introduced myself professionally and personally. So identification is the identities that are put onto a person. They are external. So the markers on your ID are, you know, female, the race selection options on the US Census, those are predetermined. You have to select from and choose which of those identities might best fit you. And it's really important to remember that these identifications are not internal in how we identify ourselves. They're not usually the language that we would use to describe ourselves if we were getting to know someone or if we were asked to write a brief bio for a website or for a training, for example. And so when we have those external identifications as a factor of those privileged and oppressed identities, then we have how we identify ourselves and the language that we might use to identify. When we're looking at a group of people, we all have automatic and unconscious and conscious biases, right? So we, our brains are automatically making a lot of decisions for us and drawing conclusions. And we have a tendency to conflate identity and ideology, which means that we're assuming that all people of certain groups think in the same ways, feel the same ways, share the same belief systems. And that's an unconscious bias that really drives a lot of microaggressions when someone is treated as a representative of their entire group, whatever it is that their visible identification might be. So these are the types of generalizations and stereotypes that I think are easy to identify as being incorrect and being usually negative biases, but it's a really really common place where microaggressions take place. So for example, you know, my family just could not get over it that my husband's favorite show is Seinfeld and that he doesn't like novellas. And I found that to be really kind of super harmful and distasteful. He was very upset by that, and they just thought that was so innocent and didn't understand at all why that would be a problem, because they just had these generalized assumptions and stereotypes, right, that they're just applying to an entire group of people and not recognizing that they were using external identifications to classify an entire group of people with the same ideology or beliefs or likes and dislikes, and those stereotypes are really harmful. So it's really important that when we look at each face in this picture, we start to recognize that we might have an unconscious bias towards applying one of these labels to one of these images over another. Our brain might automatically associate one statement more easily with one of these faces than with another face. And I created this slide as a bias training for medical professionals in a hospital setting, because it's a hospital setting is so easy to see someone's diagnosis as the first thing that we recognize. And I think in spaces where we're talking about population health, it can be really easy to start generalizing those pieces of information. So it's helpful to remember when we're talking about population health that every number that's in the data is actually a person, and that every person is connected to a family and a system, and that the personal experiences of each of the people who are represented by that data really need to be considered when we're talking about population health as well. So we have these unconscious biases and they are structural, they're socialized, and they're personal based on experiences. And so that's why it's so important for each of us to undertake the work of really looking at the distinction between the intention of our communication and the impact that it's having. Good intentions do not prevent harm. A lot of people don't think of themselves as having bias or think of themselves as being immune from committing microaggressions against other people because they've read books, they've listened to podcasts, they've studied, they've done a workshop, and they feel like they've done the work that they need to do and the work is done. And when it comes to really working on healing the harmful structural systems of oppression, we really need to make sure that what we're doing is continued growth, continued learning, continued questioning. And if we are a person in a position of privilege, we need to make sure that we're really paying attention when someone is requesting that we change something about how we might be communicating, how you might be framing language, if you are phrasing something in a way that is, if it's brought to your attention, it's really a moment to look at that continued opportunity for growth. One of the things that I see a lot in dominantly white spaces is the discomfort of having attention drawn to having committed a microaggression. And I really see that folks want to distance themselves from that discomfort and not want to take responsibility for that microaggression or explain it away. And this is where, when we're talking about the balance of discomfort, it's important to recognize that when systems are set up to benefit certain groups of people and not others, it's automatically uncomfortable. It's actually uncomfortable in how the initial structure is set up. And so when we start to rebalance that discomfort by saying people in positions of privilege are willing to feel uncomfortable in order to create safer spaces for people who were not thought of in the design of the system and the structure, that's how we're going to start changing systems, is when we're all willing to have the uncomfortable conversation about what's uncomfortable so that we can make it safer for more folks. I would really highly recommend that people check out Project Bias. Harvard has a really great website where you can do an unconscious bias test. And it will actually, there are a bunch of different polarities that you can look at, body size, gender, different races, different belief systems, different religions, where you can actually test yourself to see where you might have unconscious biases and start looking at where dominant culture and some of our social conditioning might have been internalized, and help you direct your attention towards areas of personal growth to help really work on addressing those unconscious biases, because by definition, they're unconscious. So again, when we're talking about the balance of comfort, wanting to be able to create spaces that are safe, when we are talking about identity and identification, we're frequently talking about stars and constellations. One of the things about having a privileged visible identity, for example, being white, is that I am not seen as representing my entire racial group. I get to have all kinds of opinions that are just my own opinions. I get to be an individual, and that's privilege. When someone is seen as representing their entire group, whatever that group identity might be, they're not being treated as an individual, they're being treated as representative of a group, right? And so it's really a helpful thing to think about in a moment of a microaggression conversation, or the discomfort of a microaggression, is whether or not the comment or statement that was made was being applied to an individual as an individual, is a comment to and for building relationships between individuals, or is actually losing the individual in a constellation identity or identification from the outside, where someone is actually really not being allowed to fully be an individual in the space because they're being seen as those represented identities. So now we're going to watch a little video about how to actually call these things in when we see them or experience them.
Let's start looking at some specific ways you can show up as an ally in your workplace. As you think about the actions you might take, it's helpful to keep your privilege and positional power in mind. When you recognize your privilege, you can better see the barriers that people with less privilege face and address them as you take action. And when you reflect on your positional power, you'll begin to see where you are best positioned to drive change. Your positional power is based on your role and level. We all have positional power. In fact, we often have more than we realize. So how can you start taking action? It's helpful to think about allyship actions in 3 categories: individual, interpersonal, and structural. Individual actions are the steps you take to educate yourself, model good behavior, or change your mindset. There are many different types of individual actions. They often happen behind the scenes, but they're still really important. For example, learning about others' experiences is an individual action, and it's also a critical step towards showing up as an ally with empathy and understanding. You can also take individual actions to make your work more inclusive. This might look like using gender-neutral language in written materials, or making sure people of all races and abilities are represented in imagery. Again, these are just a few of many possible individual actions. You'll have a chance to explore others in the next part of this workshop.
Interpersonal actions involve supporting others and advocating for equity in your day-to-day interactions. Speak up when you notice inequity. For example, by correcting a colleague who assumes a new hire is straight or cisgender is an interpersonal action. So is mentoring a colleague with traditionally marginalized identity or making sure they get credit for their accomplishments and ideas. Affirming someone's experience of inequity can also be a powerful interpersonal action. For example, letting a colleague know you're thinking of them when violence or hatred against their community is in the news. As you practice interpersonal allyship actions, remember that no 2 people or situations are the same. People with similar identities can have very different experiences, needs, and expectations. It's always important to think about the individual you're supporting, the relationship you have with them, and the specific barriers they're facing.
Finally, structural actions involve pushing for more equitable norms, policies, and systems. For example, advocating for objective criteria in hiring and promotions is a structural action. Another example is encouraging your company to use software and other tools that are accessible to people with disabilities. Before you push for structural change, take some time to learn about the solutions that people with traditionally marginalized identities are already working on. Then be intentional about aligning your work with theirs. Whether your actions are individual, interpersonal, or structural, remember that allyship is an ongoing practice. There is no finish line because there is always more we can do to promote equity.
So I think it's really important to talk about how we interrupt a microaggression. And I think even in that video, it's really reinforcing that individual, group, and structural is micro, meso, and macro, right? And so when we have an interpersonal interaction or when we witness a microaggression. And so one of the things that I wanted to bring to this group was the opportunity to actually discuss how you all might be able to engage as a group in creating norms around this, around how do you call in a moment for learning? How do you name a microaggression in a way where you can actually use it as an opportunity for collective healing and collective education? So the conventional wisdom around all of this is, you know, when you see the microaggression taking place, naming it in the time that it's happening. So one of the things that I like to recommend is making sure that we're actually present in the first place. If we're not tuning in, it's easier to miss those moments of a cold prickly, right? We all kind of know from the time that we're very young the difference between a warm fuzzy and a cold prickly, like when something doesn't quite feel right. So the most important thing to do is to actually check in with the person who is on the receiving end of a microaggression or a statement that could be harmful, and making sure that if they're asking you not to get involved, even if you think you're being an ally and being protective, that it's actually the person who's experiencing the harm who's at the center of any disruption that's taking place, and that they're actually the person who's taking the lead in how it's being addressed, because we really want to make sure that no one ever increasing the difficulty that's being experienced for the person who's on the harmful end of a hurtful, biased, unconscious, or thoughtless statement. The role of ally is to support the person and also to be a buffer between the two people in that microaggression moment. And so explaining what it is that was offensive, why it was that it was something that was inappropriate, how it's representative of a harmful structural belief, or representative of an ism, right? Any ism, transphobia, homophobia, racism, sexism. How is it that what it was said was harmful from your point of view? Never speaking for the person who was the target of the comment, but being able to name the harm from a neutral perspective, to be able to say, look, this is a harmful comment for this reason. It's something that is harmful to our entire group and our ability to do the work that we're doing when statements like this are made without being addressed. So I'd like to just take a moment and see if there's an opportunity for discussion about this in the group. What does this group feel like would be a mechanism that could be put in place for naming or calling in a microaggression or harmful statement during a meeting that you all participate in? I can see it looks like Siri Gurunam Khalsa, you might be trying to speak, but you're on mute.
Yeah, I was just reflecting on what you've been talking about, and it's interesting that many conversations and meetings are, if you're aware of the microaggressions, it's overwhelming at times. And so, as a person who participates in different meetings and different settings, I'm always in a quandary of how to gracefully point out the microaggression so they can hear it. And normally individuals who use microaggressions, they're usually insecure and feel they lack power. So they're trying to overpower someone. So how to have that conversation of awareness without them feeling disempowered. And it's sort of, I haven't figured it out yet, so.
Thanks so much for sharing. I think it's something that each group figures out together, and I think that was part of why we wanted to have the conversation today, so that we can figure out what the group norms look like moving forward, or what group agreements might be able to be put in place that create a mechanism for that type of engagement or feedback.
Yeah, I think sometimes people just don't, it's not at that point in time, it doesn't seem that that's what they want to do, because they want to hold their status quo. But if you want to work as a group and be mutually with each person, seeing the strengths as well as the challenges that each person has, how to move forward with that. And you know, if anyone has any answers, please share.
Is it Anna Horner? I saw that you also came on camera. Did you have something you wanted to share?
Not necessarily, but since you called on me, I just wanted to come on camera because we were having a discussion now, and sometimes I think it's
Thank you.
helpful. Yeah. Yeah, I mean, I guess maybe in response to what the previous speaker shared, I can often feel like a lot of microaggressions are unintentional and like you said, are coming from this place of the subconscious, the unconscious bias. And yeah, I also think it can be as, you know, I can speak to microaggressions that I've experienced as a woman and just the challenge in trying to confront them without coming from a place of anger. And, you know, and then not confronting them because I don't want to be seen as angry. And so I just often have like a lot of empathy for, you know, people of color, or as I'm hearing more people say, like those in the global majority, because I think just in my own personal experience, like being able to have the personal like strength and awareness and composure, like all of this stuff that you have to manage in that moment to be able to address something like a microaggression takes just an incredible amount of energy and capacity. And so, yeah, I don't necessarily think that I know how to do that when it's directed at me. And I think when it's directed at other people in this space, I can often feel like I don't know if that other person found it to be a microaggression. And I don't want to call it out if they didn't call it out. And maybe based on what I've learned or know, I see something's not okay there. But maybe what the other person has experienced or knows, they didn't even feel it as a cold prickly or what you said. So I think that can maybe make me feel like in the moment, it's hard to know. I think I'm getting better at like managing what's coming out of my own mouth. Definitely not perfect, but in terms of being like an ally in a moment, that always feels a little bit tricky when it's a microaggression, when it's like a systemic, oftentimes unconscious bias coming through at an individual level. And I really appreciated your explanation of that. So that's just what's on my mind. I'd love to hear from other of our Health Council members.
I really appreciate what you shared. I think that for a culture that allows for so much bullying and so much harmful language and so many microaggressions, we have this kind of bizarre politeness situation as well. And I think sometimes we get stuck in that politeness situation of not knowing how to interrupt something because we don't want to make it more uncomfortable. So I can really understand that we're also facing that kind of culturalized idea that we might not be wanting to like disrupt or make something more uncomfortable, right? And there's this kind of politeness doctrine that we're all just trying to like be polite. And I think that that can complicate it as well. Go ahead, Geraldine.
No, I was also reflecting back on this and this calling in and calling out. I think you mentioned, I feel like for me, and if I understood this right, I feel like calling in is more of like a one-on-one type of thing that I personally, someone I work personally with or someone I built a good relationship with that I can put them aside and say, like, what did you mean when you said this? Like, can you explain that? As opposed to like, I feel comfortable with doing something like that, but calling out publicly, I would be less likely to do that in front of a large group. But that's kind of my thought as as we were going through this section and reflecting back on it. Sorry. And I do have one in the chat. Joyce says maybe it would be possible to say something like, what was said may not be appropriate language for the circumstance. I guess you could say it made you feel uncomfortable without bringing in the other person who might be offended.
I think all of that's really important. So for sure, the distinction of calling in versus calling out is not publicly shaming a person because they've committed a microaggression, right? You don't want to be doing setting off an alarm and then publicly shaming someone and saying, you have unconscious bias and that was a terrible and racist thing. And, you know, that's not going to heal, that's not going to help, and that's not going to move things forward. So the opportunity to, again, because micro just means one-on-one, not small or insignificant. So attending to microaggressions in micro communications, so that it is like a one-on-one interaction that you're having with somebody. And what I also love, Geraldine, about what you said is you actually framed a bunch of questions. You actually said, hey, what did you mean by this? And when you said this, what was your thought or what was your intention? Instead of, hey, you did this and it was harmful, right? And so that's also an inviting in. When we're asking a question, we're inviting in a response, and we're inviting reflection instead of naming something as bad or labeling something in a way that says, hey, you did this thing that was, you know, incorrect or wrong or hurtful. So that's absolutely a distinction of calling in versus calling out. One of the things that I want to touch on here is what we do when we're the one who causes harm. And I think that this is really important to talk about because we need to both know how to respond to harm that we witness and also harm that we cause. In a group like this, and we'll get to this in a moment when we talk about how to specifically create agreements for this group around calling in, what's important about getting present, right? So I like to do some body based. I like to take a minute to press pause for myself. Sometimes I put my hand over my heart and take a deep breath. I wiggle my toes. I feel my body and check in, because the first thing that happens for me when someone calls me in, it definitely happens even bigger if someone calls me out in public in front of other people, is that I feel ashamed because I actually don't want to cause harm. I'm working really, really hard to unlearn the systems that I've been raised in, right? And so when I commit a microaggression and someone brings it to my attention, the first thing that happens for me is that I feel shame. So you can see I'm getting a little emotional, like just thinking about it. It's so appalling, right? To accidentally represent something that's so negative and harmful, not aligned with ideology and beliefs, and yet we do it because we're part of these systems and it's in the culture and it's how we've been socialized. Learning not to be defensive, and I think that's the thing that we're all working to avoid when we see harm and want to call harm in, because once we start in a power dynamic where someone's feeling like they're defending themselves, then we're in a power struggle where we're trying to prove why we are right about the thing that they did being harmful. That's really not a helpful conversation to have when we're talking about microaggressions, when we're talking about healing and helping build community. So when I'm the person who's caused harm, it's really important that I center myself to not feel defensive and to be open to hearing the feedback that I'm being given, even if I'm not liking what I'm hearing. One of the things that's helpful to think about for me in that moment is that if I'm not liking what I'm hearing, it means that the person who I harmed really didn't like what I said. And it's for sure that they experienced more discomfort than I'm experiencing and having it called to my attention. Noticing what you feel is really important. And I think, Anna, when you're talking about that anger, right, when you're talking about the feelings that come up when you're experiencing a microaggression, and this is one of the primary weapons that dominant culture has used to maintain these cultural norms and systems of oppression, is disconnecting us from how it feels, because it feels not good. I'll be professional and not use other language, but it does not feel good. And so we have to notice what we are feeling, and we have to notice what feelings we have caused. This is where we can start learning the difference between our intention and our impact. When I am just thinking that I have very good intentions and that I could not possibly be somebody who caused harm because I'm a social worker and I've done all of this training and education and I know better. If I am not acknowledging the feelings of the other person, I'm not acknowledging the impact, right? I'm focusing only on my intention. If I'm feeling defensive, I'm only paying attention to my intention and not my impact. So it's really important that we acknowledge the feelings of others. And then we apologize and take responsibility for the fact that this thing happened, that we said something. When someone brings to your attention a microaggression, whether or not it's the person who you committed the microaggression to, or somebody else calling you in and saying, hey, I witnessed this thing and I have some questions about it, it's actually a really significant moment of trust and vulnerability. And it's a bid for connection. That person actually wants to maintain a relationship and is trying to make sure that you are responsible for your part of the relationship so that you all can continue to be in that relationship, do the work that needs to be done, work together effectively. So it's really important not to get defensive, but to really see that when someone is calling something like that to our attention, it's a moment that really needs to be honored as an opportunity for healing from both sides. When you have a group like this one, I'm quickly becoming aware of time. When you have a group like this group, it's really important to first do the level setting of having an understanding of what microaggressions are, the types of harm that they create, what the impact of that can be on a group and on the relationships individually within a group. I think we need to come from an assumption that microaggressions will take place. I appreciate those of you who've come on to talk about the fact that it's possible that they already have. I'm going to go ahead and say I haven't met you all, and I'm sure you're all lovely people, and I'm sure microaggressions have taken place because they do, because this is the nature of having these types of systems, structural systems that are harmful. They're going to play out in our individual interactions and in group dynamics. So creating group agreements, when you open your meetings, you can have some group agreements that you come to together about how you might call in microaggressions. And it might be that there's somebody who feels confident and comfortable as the person who says, I will be the call inner. And if someone sees something that's a microaggression, shoot it to me in a chat and I will call the person in afterwards because I feel comfortable doing that, or I feel safe because I have enough privilege, right? One of the things that happens in some of these spaces is that we don't want to have folks who
I think
are
we just lost
in
your audio. Or is it just me?
Oh, I can hear. It might just be you, Anna.
Oh, okay. Sorry to interrupt.
No worries. What we don't want to do is overburden people who are the most likely to experience microaggressions with the responsibility of calling them in and naming all of them, right? So white people, step up, protect, use your whiteness, use the privilege to protect the people who are going to have to do more of the work, do the heavy lifting, right? This is the period of time where we can start shifting the balance of discomfort and be willing to be the one who's uncomfortable or who's doing the work to benefit somebody else who might be carrying more of the burden of the actual harms that are being done. So this is one of the places where we have opportunity to shift that balance and say, how are we as a group going to make sure that we have a mechanism that's safe for folks to be able to call in and name microaggressions? And I also just want to share this piece of advice that I was given in anti-racism training. Asking yourself, is this a moment for me to step back because my voice is not the one that is the most important in this moment? To step up because my privilege protects me from the type of harm that I'm identifying? Step to the side because I'm going to be an ally and we're going to support, but we're doing it together, or step away because something has actually become toxic or harmful and is actually causing enough harm that it's not something that's safe to participate in. I want to go ahead and give the last 5 minutes for conversation, and I'll stop sharing. The last slide just has some of my information and resources. But I'd love to be able to just stop sharing and discuss any questions that you all have. I can see there's activity in the chat as well.
And Jesse, do you have an example of a group agreement we could share with health councils? I know some health councils have developed some of that material, so we could also reach out to health councils. But do you have an example of that we could share?
I definitely have a few different ones that I could send out to you for a conversation, and you all could craft them to meet the needs of the group for sure. Yeah,
Perfect.
absolutely.
Let me check chat. I don't really see questions, but some thank yous for this information. And I know, Jesse, that so we meet collectively once, twice a month here, health councils, but each health council hosts their own meeting with their communities in every county and tribal community. So if they're interested, is it okay to also offer your services to present at individual health councils meetings? Okay,
Absolutely. Happy to.
perfect. Thank you so much.
Yeah, absolutely.
All right. Yeah, we're getting plenty of things and interesting discussion. Any questions for Jesse or any comments before we close out today? I know we still have some health councils on here, but if you also feel like this is something you want to see more in our health council talk sessions, to have these bigger conversations, the Alliance is totally open to coordinating, these types of meetings and having these types of discussions. So yeah, let us know what works for your health council. Okay. We're getting some people dropping off. So if it's okay, we'll go ahead and end today's session. We'll send out the recording and the PowerPoint, and we'll also have Jesse's info. So feel free to reach out to her if you want her to present at your individual health council meeting. Right.
Thank
Thanks,
you all so
everyone.
much.
Have a great week.